A very good morning to one and all present here. I, Dr. Camy Bhura, Assistant Professor at BITS Institute of Physiotherapy, would like to welcome everyone in today's webinar, Role of Physiotherapy in Menopause. Physiotherapists should be aware of the menopausal process and the symptoms that can come along with the transition. Many of the symptoms can have a negative impact on women's health and overall quality of life. So, in today's webinar, we learn about menopause and its management in detail. I am pleased to introduce today's speaker, Dr. Monali Soni. She is presently working as Assistant Professor in BITS Institute of Physiotherapy, Varnama. She is having academic experience of more than 7 years. She even has done a publication in various international journals. Before starting the session, I like to request all the participants to mute the microphone in order to avoid the phone disturbance. We will be having a live question answer session at the end of the webinar. So if you have any doubts, please pop them in the chat box of Google Meet. And if you miss anything, do not worry, we will be keeping this recording on our Institute YouTube channel. Now, without wasting much time, I like to request Monali Madam to start with the session. Ma'am, please.
Thank you so much, Camy ma'am, for such a nice introduction. As Madam say, today's session, which brief out about the menopause, how it affects a woman's quality of life, and physiotherapy for the same. As all of you know, one of the major life-turning events in woman's life is menopause, which creates hypoestrogen condition. This low level of estrogen may increase the risk of osteoporosis, joint pain, weight gain, increased risk of the coronary vascular disease, even breast cancers and the memory issues. Now, we see basically what is menopause is. It is last menstrual flow experienced by a woman. The word menopause is synonym with the phrase the change of life. That is, anatomical and the physiological changes that occurs as a woman proceed from her fertile to infertile years. Now, we have one more terminology named climacteric syndrome, which is interchangeably used with menopause. But menopause is referring to a specific event, the cessation of menses, while climacteric syndrome is a gradual changes of ovarian function and which even start before the menopause. As per research suggests, approx age of affection is 45 to 55 years, but it varies with individual, while the symptoms of climacteric syndrome is more severe in first 5 years. Despite of high prevalence of these symptoms, only 1 in 4 patients who consult a doctor. So to improve overall health and well-being, after 40s is the right age to emphasize on health promotion. That is, proper education about importance of exercises, diet, and lifestyle modifications to prevent future complications. Now moving on, types of menopause. There are mainly 2 types of menopause. Physiological menopause, which occurs with decline of ovarian function, while pathological menopause, in which premature menopause, where the cessation of ovarian function start before 40, right? In which the morbidity and the morbidity rate are very high. They are more prone to develop health-related risks in future life. Second one is artificial or surgical menopause, where the permanent cessation of ovarian function is induced through the surgical interventions like removal of ovaries or medical treatment like chemotherapy or the pelvic radiation therapy in treatment of cancers of uterus, breast, or even with the ovaries. Another one is the delayed menopause, right? If it is started after age of 51, then it may be considered as a delay. Going further, there are the mainly 3 stages. Perimenopause, which begins several years before menopause, when ovary decreases estrogen production. Second, menopause is when it's been a year since a lady had missed the period, where the ovaries has already stopped releasing the eggs and even the estrogen. And the third phase is the postmenopausal phase. The years after the menopause, the symptoms like the hot flashes and other night sweatings all are the reduces with the time. But health related risk the due to the loss of estrogen increases as the age is increases. Now we are going to see which are the symptoms which are faced by the lady during hypoestrogenic phase, that is perimenopausal and the menopausal phase. Here, as there are the changes in the various hormones, along with the estrogen, there is testosterone, progesterone, prolactin, oxytocin, and endocrine, which provokes series of symptoms like vasomotor symptoms, which affects almost 79% to 86% of the cases. In this, the woman may have hot flashes, which is excessive perspirations around the neck and the face, which generally provokes her in the middle of the night and causes sleep disturbances. Along with that, chills, anxiety, and palpitation. These are the very frequently seen symptoms during the during the perimenopausal phase, which affects the severe quality of life of a lady. Moving to next is the menstrual irregularity. Menstruations may be stopped suddenly or menopause may be heralded by irregular menstruations like single menstruation, then 2-3 consecutive ones may be missed, or flow may vary from cycle to cycle, or flow may become progressively less with successive cycles. Coming to next is the genitourinary syndrome. In genitourinary syndrome, vaginal dryness is seen in 90% of the cases, which results from the poor lubrication, and it is one of the causes for the vulvovaginal itching too. Female during this stage are get frequently infected because estrogen is the one of the responsible to maintain the acidity of vaginal discharge. Due to hypoestrogenic condition, the secretions become more alkaline and it's failed to protect against the various infection. Next is the moving further. Next is the pelvic floor muscle weakness and prolapse. Here, there is a gradual atrophy of the all chip target organs responsible for the estrogen, that is the ovaries, uterus, cervix, and vagina. Along the atrophy of these organs, there is an atrophy of the surrounding structures of the genital tract. May affect the pelvic floor support and which is mainly predisposed to the prolapse. The genital atrophy problem do not improve with the time like hot flashes and the night sweats. Even the progressively become more severe and affects sexual health and the quality of life of the patient. Further, there is an atrophy of epithelium of urethra, bladder wall, even the trigone, which are thought to be responsible for the urinary symptoms. And patients may often complain of cystitis, there is a frequent infection, urinary tract infection, urethritis, dysuria, and urinary and the stress incontinence. One of the major affection of the quality of life is a sexual dysfunction are likely to be present and increase from perimenopausal to postmenopausal phase, which ranging 42% to increase up to 88%. Research also suggests that the 10% of the women avoid having a sexual relationship, and these percentages are also increases in the postmenopausal woman, which up to increases 33%. So it affects badly the quality of life of a lady having a menopause. Now coming to the next, that is a psychological and emotional changes during the peri and the
Ma'am, sorry for disturbance, but I think your presentation we are not able to see. Your PPTs we are not able to see.
Okay, ma'am.
I request all the other participants to please do not share your screen. Please cooperate. Yes, ma'am. Now it's visible.
Okay, ma'am. Thank you so much. Yeah. You might heard or even felt sometimes that your home environment may depend on your mother's mood, right? According to the study, each woman may experience more than one symptoms. They may be anxiety, depression, irritability, dysphoria, nervousness, bad mood and sadness. In 82% of the cases, even there may are suffering from the memory loss which is related to the stress. This kind of changes is mainly because of having a physical changes that the woman goes through and affects her very badly. Now looking towards the postmenopausal symptoms, here our major concern is osteoporosis. Both trabecular and the cortical bones are lost approx 50% by the woman throughout her life. But bone loss are become more prominent after the menopause, which is supported by a study, shows that the removal of ovaries, there is a 2.5% bone loss per annum following the first 4 years, and then it rate is decreases up to 1%. Next, if we are talking about weight gain and the cardiovascular diseases, the estrogen, progesterone, and the testosterone. These hormones are the very important for the metabolism of the glucose and fat as well. Imbalances between these three hormones may predispose to the insulin resistance and the glucose intolerance, which further increases the risk of the weight gain, increase the risk of type 2 diabetes mellitus, and further increase the coronary artery diseases or the heart diseases. Next is the breast cancer. There is a no direct correlations between the breast cancer and the low estrogen level. But women, those who are taking additional estrogen therapy to for the treatment of the perimenopausal symptoms, they are more prone to having a risk of breast cancers. Even if the persons may having a strong family history, in that situation, the risk of developing breast cancers is very high. Now coming towards the management, there are mainly two type of the management, hormonal and the non-hormonal management. A numerous RCT have demonstrated that the hormonal therapy, that is a oral or maybe a transdermal estrogen patch, represent most effective treatment for the menopausal vasomotor symptoms and related issues including sleep, irritability, decreased quality of life, and even women with a high risk of developing osteoporosis. As shown in figure, that these are the new options available and which are the available in the combinations of the variety like estrogen and progesterone, estrogen and estradiol, right? And these are the very effective for the treating the perimenopausal symptoms, right? So that are the transdermal gel, spray, and the vaginoestradiol releasing ring. This ring is mainly used and in which the specific dose which is a decided which will be a release every day. So it will be a more effective. While the transdermal gel and the spray, they may have some side effects with the woman, those who are having the small children and the pets. There is a one another study which is done in December 2014, which suggests that the hormonal replacement is promising intervention in the treatment of the perimenopausal depression. But they have also suggested, however, any form of the hormonal therapy, either you are using oral, either you are using transdermal, either you are using systemic, right? Any form of the hormonal therapy is ineffective if the all women are already into the postmenopausal period, right? In spite of the high effectiveness, there are having some side effect with this hormonal therapies are breast tenderness, bloating, bleeding, increased risk of neoplasia in the breast and the uterus. So we will see the other option is non-hormonal therapy. In the non-hormonal therapy, in which the behavioral therapy, which mainly the simple behavioral measures for lowering the temperature, as shown in the image, you can use the portable fans, dressing in the layers of the clothing that can easily be shed, avoiding the triggers such as a spicy food and the stressful situations. She should also be emphasis on the regular exercises, yoga, peace respiration, relaxation training, mindful-based stress reduction, and acupuncture. A systemic review and the meta-analysis of RCT in January 2020, they recommended acupuncture as a clinical treatment of perimenopausal depression, as it is safe and effective. Moreover, it has a more stable long-term effect compared with the antidepressant and the hormonal replacement therapy. Now, coming to the assessment, there should be a thorough evaluations which initiate with an interview to review of symptoms. The review of the symptoms mainly focus on onset and the severity of symptoms, past medical and obstetrical history, medication, history of the psychological and the social stresses. Right, so we should be mainly focused on the history based, right, and through which we can view out the what are the symptoms she may be passes through. Next is the pelvic floor examination. With pelvic floor disorders, the woman with the menopausal woman can become with the variety of the pictures having a pelvic floor dysfunctions. There may be increased frequency, urgency or incontinence, frequent urinary tract infection, prolapse, vaginal dryness, painful intercourse, and pelvic pain. For this kind of the complaints, we should be go for the thorough history, and which is very important. For taking objective measurements, one should go with the frequency volume chart, paired test, biofeedback, and the visual analog scale. Right? Ideally, we are using the visual analog scales to rate out the pain severity. But here, the visual analog scale can be taken as to rule out the severity of the urinary incontinence, in which there is a 10 centimeter line will be drawn. 0 indicate no wet or no leakage, while the 10 indicates severely wet or the severe incontinence. Right? So these are the objective measurement which should be also taken to objectively rule out the severity and the symptoms of the incontinence. Moving to the next is the menopause rating scale is used to assess symptoms or the complaints of aging woman under the different conditions. It consists of 11 items which covers somatic, psychological and neurological symptoms with scoring scale from 0, that is indicate no complaints, to 4, which is a very severe symptoms. One of the traditional methods we are used to check the pelvic floor muscle strength through the vaginal palpation, right? For that, we are using Laycock grading, which is a 6-point scale. 0 indicate no contraction and the 5 indicate strong. But one of the drawbacks for using this kind of method is we cannot isolate the pelvic floor muscles from the use of the other accessory muscles. So beyond this traditional method, to evaluate it properly and for effective pelvic floor muscle rehabilitation, nowadays EMG and the vaginal manometries are used. But the cost of for assessing through the EMG and manometry is very high. So it is not recommended as a clinical practice. But still, there is a very high effect. They are showing a very high effectiveness with the treatment with the EMG and the vaginal manometry. So next is the EMG. EMG is mainly performed for evaluating and discriminating the use of the other accessory muscles, right? For that, in EMG, we are using the internal vaginal or the rectal sensor with 2 surface electrodes, which are placed on the rectus abdominal muscles, either to the ASAS on the medial aspects, and 1 ground electrode will be placed over the hip bone. Then the sensor will be inserted into the vagina and the person is asked to contract the pelvic floor muscles repeatedly at a regular interval. Right? In the figure 1, here it is a show the pink color tracing, right? That pink color tracing is shows as excessive accessory muscle utilization, right? With in figure 2, it shows with the proper rehabilitation, pelvic floor rehabilitation, proper guidance, proper instructions, right? And after following a few sessions of pelvic floor rehabilitation, the patient significantly reduce the use of accessory muscles while contract the pelvic floor muscle. So it is very important to isolate the muscles while the treatment. Next is the pelvic floor, which is used to check the strength of the pelvic floor muscles, right? In the figure, here it shows the patient with the urinary stress incontinence, right? If the patient is asked to contract series of rapid contraction, like a quick contractions, right, over the 5 seconds of interval, right? As you can see in the figure, there is a 5 seconds of interval, 0, 5, 10, 15, and the 20, right? So over the 5 seconds of interval, the person is asked to contract quickly, right? But once the patient starts contracting, that the patients may suffer to difficult to see the electrical activities and recruitment of the contractions, which can be improved with the pelvic floor rehabilitation, and that is shown in the figure 2. So there is a difference of the recruitment and the contractions of the muscles with the pelvic floor muscle contraction, and which can be improved with the rehabilitation. So this is one of the things that we can also give the feedback to the patients before and after the treatment. Next, it is also used to check the endurance, right? So in that, the here in the first figure, it shows you the short tooth pattern, right? That short tooth pattern may indicate that the persons are unable to sustain the contraction for a prolonged period of time, right? And with the rehabilitation, as shown in the second figure, that the persons are increases the endurance and it shows the sustained contraction for a prolonged period of time. Another things that is very important with the EMG is to identify the hypertonic stage of the pelvic floor muscles. Patients who are suffering from the chronic pelvic pain, in which there is inflammation of the pelvic floor muscles, and due to that the muscles will remain in the spasmodic stage, right? This spasmodic stage may creates the hypertonic stage of the muscles, right? So here there is a repeated insertional activities which can you show in this picture, that shows the patients may having a hypotonic stage of the muscles of a pelvic floor, right? And with the relaxations, proper instructions, and the rehabilitations, that the hypostenic stage can be reduced with the rehabilitation, right? So there will be a no activities can you can see in the second picture, right? So coming, this is all about the EMG, but though it is very effective, we can identify particular cause which may responsible for the pelvic floor dysfunctions, and we should only focusing on the specific goal, right? Here in the we are mostly using the traditional therapy, in which the multiple interventions are using for the pelvic floor muscles, but we are only using as a trial and error purpose. But with the EMG, we are specifically identify the cause, and according to that cause, we are mainly focusing for the pelvic floor muscle rehabilitation. But the cost of with the EMG is very high, so it will be not possible for the each and every person. That is one of the drawback with the EMG, right? So if we are looking further, there are the other examination, right? As it affects the whole body of the patient, right? So it may affect the other joints, osteoporosis, increased risk of cardiovascular, right? So according to that, we should be evaluate a person thoroughly. But whatever the persons comes with the complaints, that should also be assessed properly, like a range of motion, strength, tightness, endurance by taking a 6-minute walk test, right? So that all should be checked during the assessment. Now coming towards the physiotherapy management, while prescribing exercise for the menopause or the postmenopausal woman, as it affects overall health and the quality of life, so rather focusing on a specific one system, we should go with a multidisciplinary approach, which may include pelvic floor muscle rehabilitation, aerobic exercise, weight bearing, resistance exercise, strength training, and diet and lifestyle modification. So first, we will see pelvic muscle rehabilitation. In the menopausal woman, the main objectives of doing pelvic floor muscle rehabilitation is to improve vaginal health, right, and the recovery, right. As we see in the previous slide, that the low estrogen level significantly affect the vaginal wall atrophy. Even it may lose the elasticity and it may reduce in the size of vagina. So that will be very important to improve the vaginal health. Together, there is a increase the knowledge of about pelvic floor dysfunction to improve the tone and the strength of the muscle. Next, to improve the muscle mass, right? As I told you, there is a significant atrophy of the vagina, right? There may be a significant atrophy of the clitoris and labia majora and the minor, right? So all it is very important with the proper exercises, we should increase the muscle mass. Improvement in the muscle relaxation. It is very important for teach the patients to relax the pelvic floor muscles, and it is also required to increase the elasticity of tissue and decrease or desensitize the painful areas. To achieve all these goals, we can go for the Kegel exercises. To teach Kegel exercises, first of all, very important things that we should show the proper diagram of the pelvic floor muscles to the patients, right? Why it is so important? Because most of the patients may have a confusion with actually which muscles they have to contract, right? So with this showing the diagram, the patient have at least idea that they have to contract, that is a fan shaped pelvic floor muscles. It can be performed in any position, but for the beginners, we should ask the person to sit in a chair in a such a way that the perineum, right, the floor of the pelvic floor, that is a perineum, consider as a perineum, which will be a directly come in contact with the chair, right? And that base of the chair will give the sensory feedback to the lady, and it will be very easy for the patient to lift her pelvic floor muscle up, right, and contract the pelvic floor muscle against the chair, right? So this may be for the beginners. It is very important to start in the sitting positions, but it can be done in any positions, in a standing, in a walking, in performing other activities too, right? For the pelvic floor muscle contraction, we should advise a patient to contract the muscle as you are stopping, passing a water or the urine, right? Or you are holding a urine in a midway. So these instructions are very important that the persons can get the actual idea how to contract the pelvic floor muscle. Another things about the pelvic floor muscle is they are the smooth muscles. They are easily get fatigued. So advise quick contractions like contract the pelvic floor muscles with the counting 1, 2, 3 and relax. Right? We will be having a quick contractions. Right? You can advise 200 contractions in a day, but it should be in a set of 10 or 20. Right? So we are advising at a time only 10 or 20 contractions. If we are persisting more, then the pelvic floor muscles are easily get fatigued. So the number of the frequency treatment should be increased 4 or 5 times in a day, right? We should also take care while teaching the Kegel exercise that the patients cannot use the accessory muscles like gluteus maximus, hip adductors, abdominal muscles, and sometimes patients are also doing breath holding while performing the exercises. So these things should be discouraged. While teaching the Kegel exercise, the importance of the Kegels are also be explained, and the person are also explained about the also about the counter bracing. So what is the counter bracing, right? Some of the patients may are complaining that they're having an incident of the leakage while sneezing, coughing, lifting, jumping, right? Bending forward, lifting something from the floor, right? During that period of time, they may have a complaints of leakage, right? So during performing this kind of activity, or even if the persons may having a strong desire to urge, during this period of time, she will ask to contract the pelvic floor muscle strongly, right, in order to prevent this kind of accidents, right? So that is very important thing that we should also advise or teach about the counter bracing, and we can also minimize the accidental leakage. Now we will see how the biofeedback and the perineurometers may helpful in the pelvic floor muscle rehabilitation. As you can see in the image, there are the two pictures. That is, the one is for biofeedback and the second is the perineurometer. In both, they have a vaginal sensor which is inserted into the vagina, and then the person is asked to contract the pelvic floor muscles, right? Which shows the signals on the visual display unit, either auditory or the visual, even sometimes graphically in the biofeedback. And same way, there may be having a pressure changes over the dial in perineum, right? To make the session more interesting, the therapy is combined with the games, right? As you can show in the first figure, they have a using the smartphone with the sensor, right? And this is a mainly incorporate with the game, so the patient can done exercises even with the use of the smartphone, right? So the same concept is by using the vaginal sensors, they are more emphasis on the pelvic floor muscle contraction. But one of the drawback with this kind of therapy is we cannot differentiate the contractions between accessory muscles, and with this kind of therapy, the patients are more rely on the auditory and the visual outputs, right? So without them, it may be having a difficult for the patient to contract the pelvic floor muscles, right? And if they are using excessive accessory muscles rather than the pelvic floor contraction, still they are getting the auditory and visual outputs that indicate that the patient feels that they are actually contracting the pelvic floor muscles, but in the real scenario, they are using the other accessory muscles, right? So it will be easy for the initial period of time where the patients cannot be having a cortical awareness how to contract the pelvic floor muscles, right? So the best options to avoid this kind of using of accessory muscles, EMG and vaginal manometry, which is the best option. But as I told you, the cost is very high, so it may be a less effective. Another one which is used to strengthen the pelvic floor muscles are the vaginal cones. One of the attempts is made to strengthen the pelvic floor muscles or to increase the strength and endurance of the pelvic floor muscles, right? There is applying a graded resistance, right, which is available in the different weights, which is ranging from 10 to 100 grams. For the using of the vaginal cone, the lady first start with the lightest cone, and then she will advise to walk around. During that, the cone will forcing the pelvic floor muscles downward, and feeling of losing that cone makes the muscles to contract. This is the main concept how to stimulate the pelvic floor muscles, right? That the resistance of the cone which create the downward force over the pelvic floor muscles, and the lady may feel there is a losing of the cones, right? And that losing of the cones makes stimulate to contract the pelvic floor muscles, right? If she can able to retain for 15 minutes, then she can progress to the next higher weights, right? So this is the all about the vaginal cones. Now moving towards the electrotherapy, there is a beneficial effects from the IFT and the electrical stimulation has shown. As shown in the figures, the IFT can be used for the treatment of the pelvic floor dysfunction or mainly in the incontinence. Right here, the person main objectives for using the IFT is only that it will provide the cortical awareness, which facilitate the ability to perform the voluntary contraction. So initially, if the persons may find difficulty to understand which muscles to contract, which is a very beneficial. That the study also proven that the 8 to 10 therapy sessions with the IFT may significantly improve the pelvic floor muscle contraction. Here, it can be given in the two positions with the four polar method, either in the supine line positions or either in the crook line positions. In the supine line positions, the electrodes are placed in either side of inguinal just above the inguinal ligament, and the second pair of electrode are placed in a thigh, right, just above the adductor triangle. In the second, the in the crook line positions, the persons one pair of the electrode are placed just medial to both ASIS and above the pubic symphysis, and the second pair of electrode are placed over the ischial tuberosities. Right. If we are talking about the EAs, right, the pockets, cigarette pocket size portable ES with the internal vaginal electrode shows effective to improve the strength as well prevent the vaginal atrophy, as it preserve the muscle bulk, capillary bed density, and increase the ability to utilize the oxygen, right. So those patients who are more conscious about or having a sexual discomfort, right? In that situation, the portable ES with the internal vaginal electrodes are proven effective to prevent vaginal atrophy. So, this is all about the modalities. Now, menopause friendly exercise. It shows that there are the various interventions are proven effective individually while treating the postmenopausal woman, right? And that significantly improves the quality of life as well as improves the bone mineral density in the bone and prevent in osteoporosis. One of the studies suggests for the bone remodeling, the main bone remodeling is controlled with the circulating hormones, vitamin D, calcium. Along with that, there may be having an effect from the gravity, weight bearing, and pull on the bones by contracting the muscles. So this study indicates that the as we cannot regenerate the hormones after the menopause, right? So with for the emphasis on the bone remodeling, we should more emphasis on the weight bearing activities, resisted training activities. Even we should be more emphasis on the strength training activities, right? So this may indicate the bone remodelings having effects from the gravity, weight bearing, and even with the contractions of the muscles. Another study may also suggest that the aerobic exercise, if coupled with the weight bearing, that significantly increases bone mineral density at the spine and the wrist of the postmenopausal woman with the osteoporosis, as it compared with the control interventions. Other exercise suggests if a mix of cardio and the resistance exercise is there, it is very beneficial in preventing the fractures, maintaining the bone mineral density and the body weight. On the other hand, if we are talking, the deep breathing, yoga, and the stretching exercise can improve or can help to manage the stress of the life and the menopause related symptoms. So, whether we are focusing on single intervention, the lady should be engaged in the all variety of the exercise to get the maximum benefit. For that, she should prescribe stepwise approach. First, in the first step, we should mainly focus on the warm-up, right? As owing to the age, the body become a less flexible. It is very important to warm up the body before workout. For that, she should ask to go for the stretching exercise or walks on a treadmill for 5 minutes or go for the brisk walking outside. Step 2, she should engage in the all high impact aerobic activity which elevates heart rate and burns fat. For that, we should advise her for advise certain activities like running, jogging, stair climbing, walking on a treadmill or the outside, right? All these activities are mainly targets a large group of muscles and which helps to improve the cardiovascular function. In step 3, as the menopause is very common time for the woman to experience a bone loss and the density or osteoporosis, right? So they aid to keeping their bones strong by keeping muscles strong, right? Due to that reason, we should emphasis of weight or the strength training or the resisted training exercise by using weight cups, dumbbells, and therabands. Next is the that the workout should be emphasis that causes the stretching of the muscles, such as the yoga and the Pilates, right? Which promotes better muscle function, and the woman must take some times to do yoga every night and keeping some meditations, right, which significantly reduce anxiety and improves the cognition function. As we have seen, 30 to 40% are the lady affecting with the memory issues due to stress, right? So yoga and the Pilates, this may helps to reduce the cognitive issues as well as it reduce the anxiety. Not forget the important aspects of the protocol is the cool down period, right? At the end of the workout, she should advise to work for a few minutes or moving body for a few minutes in order to relieve pain and any other side effects from the particularly during the workout, right? So along with that, along with the good habits of the exercise, we should also emphasize on the proper diet, which plays a crucial role in the prevention of the osteoporosis. The study shows that the calcitonin and the biphosphonate, which slow down the bone reabsorption and the decrease bone loss. Exogenous calcitonin can reduce fracture risk in women 5 years or more than menopause do not take the estrogen. If they are taking estrogen, the osteoporosis may have risk of osteoporosis is less. But if they are not taking estrogen, then additional taking of calcitonin is very beneficial in order to reduce the risk of fracture. So the calcium consumptions may be the most important modified factors for preventing the osteoporosis. As per recommendation, the daily calcium intake for the premenopausal woman or the postmenopausal woman who are not taking estrogen is 1000 milligram per day and 1500 milligram per day for the postmenopausal woman who are not taking estrogen. Along with the calcium, vitamin D is also important to convert the calcium into usable form, right? So daily recommendation intake of vitamin D is a 400 to 800 international joule. So it is a recommended along with the exercise. Women should also be advised to take oral pills or increases the natural source from the body, natural source from the diet, right? As shown in the figure, these are the natural sources of the calcium and the vitamin D. So here, these are my reference for the today's presentation. Thank you.
Thank you so much, ma'am, for sharing your knowledge with us. Now we will go ahead and take some time for questions.
Yes, ma'am.
Participants are requested to type your doubts in the chat box. All the participants have been requested to type your doubts in the chat box. Ma'am, we'll wait for a few minutes if they have any doubts.
Yes, ma'am.
Participants, if you have any doubt, you can write down in the chat box. We'll wait for a few more minutes. I
Sure,
request all
ma'am.
the participants, if you have any doubt or query, you can write down in the chat box. Yes, ma'am. We have one question from Shabnam.
Yes,
How
ma'am.
to convince women for high impact activities in aerobic exercise as Indian women do not take this consideration to exercise and why it is needed?
Okay. Uh, as I have told, the high impact activities, but it is good if we have started as early after the 40s, right? Because once she stops releasing the estrogen, the risk of this diseases like joint pain and the osteoporosis are more, right? So it is maybe difficult for the patients to perform the high impact aerobic activities. Instead of that, if the patients deny for this activity due to pain and other reason, or if she having the less time with their household activities, simple brisk walking for 45 minutes in a 3 days per week is also beneficial and having the same effect on the bone density compared with the high impact aerobic activities. Even she can also go for the jogging 1.5 kilometers per hour if she is using this speed, and if doing running and the jogging, having the same effects like the other aerobic activities. So if they are not convinced, we should go for the further like a walking, brisk walking, running, or the jog. But it is very important to create the stress over the bone in order to prevent osteoporosis.
Yes, ma'am. We have another question. If the patient is instructed for doing exercise at home basis, how will he or she be knowing it works well or not? And how Kegels performed in the same way for men too?
Uh, your question is the patient is instructed for doing exercise at home basis. How will he or she be knowing it works well or not? And Kegel perform for the men. Okay. If we are emphasis for a precautionary basis that significantly improves the quality of life of the patient, as with the aerobics, there are release of endogenous opioid, and that endogenous opioids makes the persons to feeling good, right? So there is a definitely benefit of the having the regular keep the habits of regular exercises, and definitely it improves in the symptoms and patients come to know whether it may be worsen the situations or it may be improved. If it getting worsen, they should immediately inform or contact to the physiotherapy, or else we should advise the home basis exercise. Along with that, we should also call for the regular follow up, and through which follow up we can come to know whether they are doing properly or not. And if we teaching the same instructions given to the men for the Kegel exercise, there are the three openings for the urinary and the sorry, in the men there are the openings are also there, and the pelvic floor muscles are like a fan shape, right? So whenever the person try to contract anus and the pubic anus and the urethral openings together, there may be a contraction of the pelvic floor muscles, right? So it may be a same as the instructions will be same with the men's also.
Yes, ma'am. We have one more question from Redula. Is osteoporosis hereditary and will it transfer to her if her mother is having?
Yes, there are the maximum chances that the females may have a tendency to develop the osteoporosis if there is a strong family history is there. So it is a better to advise to start taking the lifestyle modifications and health promotions as you enter before 40s.
Ma'am, we have another question from Johnsy. Is it necessary to take medicine along with the physiotherapy management or else physiotherapy management alone is enough?
Uh, as I told you, it affects overall health of the body, right? So we cannot replace the calcium deposition in the bone only with the exercise. So it is advisable to take medications along with the physiotherapy management. It gives the better results compared to the physiotherapy alone.
We have another question from Rashi. Is it necessary to advise women calcium tablets immediately after the menopause? I think we have covered this question in Johnson's, so
Yes.
we'll proceed further. We have one more question. If patient have prolapse problem, so how we can do menopause exercise?
As I told you, that the initially the patient should advise for the counter pressing. Once she learns skillfully, then you should go for the further activities. And for before starting the other exercises, we should, I have more emphasis on the pelvic floor rehabilitation, and then I have started the other programs. Right. So first emphasis should be taken on the pelvic floor rehabilitation. Once the patients will gain the sufficient strength, and if there is a decrease grades of the prolapse with the interventions, then only she will be advised for the high impact other activities.
Ma'am, we have another question from Palak Vyas. Will
Yes,
there
ma'am.
be a difference of menopause symptoms which is pathological or physiological?
No, no, but the age as I told you, there is an approximate age of the starting menopause symptoms is the 45 to 55 years, right? But if the persons may have a additional history of having a carcinoma of uterus, carcinoma of breast, or if they are underwent for the certain surgeries, like the removal of the ovaries in case, or in case they are underwent for the chemotherapy and the radiation therapy, the persons may having a early cessation of the ovarian functions and start symptoms of the menopause. But the symptoms will be remain same. But though it is induced to the surgical, that's why it is considered as a pathological.
We'll wait for 1 minute more. If
Yes, ma'am.
somebody have any doubt, then we'll proceed. I think we have covered all the question. So
Okay,
let us
ma'am.
move towards the vote of
Ma'am,
thanks.
before you conclude, I just want to say
Yes, ma'am.
thank you so much, Principal of BITS Institute of Physiotherapy, Dr. Mehul Jadhav sir, and Vice Principal Dr. Sarfaraz Namaskar sir, for providing us a better platform to represent myself and giving us such a nice opportunity. Thank you so much. And I would also like to thank all the participants for taking active interest and showing your interest throughout the sessions. And all my colleagues and the staff members for without their support, I cannot be able to present such an event. Thank you so much, everyone. Thank you. Thank you so much, Camy Madam, for coordinating this event very smoothly and nicely. Thank you, ma'am.
Thank you, ma'am. So we'll move towards the vote of thanks. On behalf of entire BITS Institute of Physiotherapy, I deem it a great honor to propose the vote of thanks to all who have helped us in making this webinar such a resounding success. First, I would like to propose a vote of thanks to our speaker, Dr. Monali Soni, for gracing today's webinar. Thank you so much, ma'am. Session was very interesting, meaningful, and thought-provoking. I extend my thanks to Honorable Founder, President, and Chairman Sri Jagdish Bhai Patel, sir, our Joint Managing Trustee, Srimati Kamalben J. Patel, Madam, for their constant support. I extend my thanks to our Chairman, Dhruv Patel, sir, who allow us to organize such webinars, and our Campus Director, Hardi Patel, Madam, for constant motivation. I would like to express my profound gratitude to our Principal, Sir, Dr. Mehul Jadhav, Vice Principal, Sir, Dr. Sarfraz Nawasha, for their enormous cooperation. My sincere thanks to our respected Garirada for wonderful graphic designing. I like to thank all the participants who had made the event success. Lastly, I am happy to express vote of thanks to all the staff members who have made this webinar a grand success. Thank you all.
Thank you, ma'am.